Dr. Shark here, Shark Holistic Health. I'm going to talk about systemic endocrine imbalance. What is it? So your endocrine system is your hormone system. And most people, when they hear hormones, they only think about sex hormones, right? So estrogen, progesterone, testosterone, those kinds of hormones. However, you have a lot of different hormone producing and hormone regulating organs in the body. So you have your adrenals, you have adrenaline and cortisol. You've got your thyroid that makes thyroid hormone. And then you've got hormones that control your thyroid, right? And then you've got your liver, who is a super big player in the hormone game, not by making hormones, but by regulating what kind of package hormones are in. So first off, if you have a liver dysfunction problem, eventually you usually get a hormone problem, because even if everybody else were magically producing the right hormones, the liver's not packaging them right, and so they can't plug in where they're supposed to go, so they don't actually do their job. So that's the first most important thing. And when we're thinking about endocrine imbalance, if we have a liver dysfunction, that's going to be the thing we really want to focus on, more than correcting all these things. So a lot of these modern naturopathic functional medicine type doctors want to get in there and try to kind of play games with your hormones. They run a lot of tests and they want to supplement this and that, and then this, and then that, and then this, and then that, and this. And really what they're doing is that they're playing a game where they're trying to correct lab results. But the hormones are like a web that everybody works together off of each other. So if one gets off, it pulls the other ones. So trying to just add hormones doesn't fix this problem at all. So the first thing is liver dysfunction. You have to address that. The second thing to look at with endocrine imbalance, hormone imbalance, is immune function. So a really common cause of endocrine dysfunction is somewhere in this web, in one of these or maybe more of these endocrine organs, there's some kind of autoimmunity, right? That could be something like Hashimoto's or Graves' disease, something like that, that is affecting the body's ability to regulate or produce hormones correctly. So the solution to something like Hashimoto's is not thyroid hormone. People may take thyroid hormone as an emergency treatment because their hormones are so low that it's unhealthy and it's dangerous, but it never fixes the autoimmune disorder. So the real underlying treatments for these endocrine imbalances are to either treat the liver or whatever's going on there. Why is it not packaging the hormones? The liver always does hormones last, so you pretty much have to fix all the other problems with the liver, so it will do the hormones. And the immune system, looking for how well is that functioning? Is it just inflammatory, or have we gone over into autoimmune? That will have a huge effect. The third thing is blood sugar imbalance. If your blood sugar is really unstable, your adrenals get extremely taxed and they start doing something called pregnenolone steal, which is where they steal the ingredients for your other hormones to make more adrenaline. So we don't want that, right? We don't want your adrenals having to steal your hormones. So that's the third thing that we look at. If your blood sugar is imbalanced, that has to be treated to fix your hormone situation.